Hey, another video. And do you remember that I made a video one time about radiation and how it is harmful, especially to the unborn child? And I was looking for this book that was called The Business of Baby, and I couldn't find it anywhere. But I did find the author, and she told me that she had to change the title of the book to get it published. So she published it under the title Your Baby, Your Way, but it's the same book as The Business of Baby. And there's actually a movie is called The Business of the Unborn Child or something. The Business of Being Born. And so this book was very an eye-opener about how hospitals are in there to earn money. And of course, they want to be minimally staffed and send you the highest bill possible. So just a little bit of background. My sister is a midwife, and she helps women give birth at home. And then you can, do that in a bathtub or in your own bed a little bit higher up. And so it's very personalized and peaceful. And so I'm very proud actually that my sister does the work that actually has it's the most beautiful experience in the life, giving new life. And it's an experience for the mother and child. So you want to make it as comfortable as possible. And so, of course, this experience should be good, but the book written about most deliveries in the United States is very, very negative. Not only very expensive, but also almost violating the the new mom's body. She's actually strapped down to a bed and then to a fetal monitor, and then they give her a pito coin, which actually increases the contractions. And but it actually is a very stressful experience that actually endangers the life of the mom and the baby, and increases also the risk of having a C-section done. And we'll see later on that there, of course, C-section, you think it is for convenience or for the safety of mother and child, but it's actually the opposite. Anyways, I'll just start resuming the book. This book is well researched, and it is a must-read for expectant mothers. I'm not expecting a child. I'm over the age of having children, but because of my sister's work, and because we live now in an age where the world population is declining and births are also declining, not only because it is expensive to have a baby, but also because the fertility rate is down by a lot. And you'll see that vaccinations have a lot to do with that. But if I would have been pregnant, then I would want a vaginal birth and home birth as well. I would breastfeed, and I would not want my baby to be vaccinated. So that's almost impossible to have a child like that in this world. And yes, if these things that I say make you feel uncomfortable, then we need to discuss this topic even more. Because another thing is the ultrasounds. That was actually the previous video. I was talking about the ultrasounds being done, and that it's not harmless for the baby at all. Actually, for the most ultrasounds, you can see the baby on a screen, and you see that the baby often wants to hide in the placenta, keeps the hands on the ears, and you can see that the baby is actually in pain. And the more ultrasound you do, the more risks there are that the baby will suffer autism or ADHD or other birth defects. So more ultrasounds will not guarantee a more healthy baby. It's the opposite. Remember that a woman's body is powerful, created by God, and that we are connected to the generations of women who came before us, and that our bodies and our babies usually know just what to do. Yes, because they consider a pregnant woman a sick person in hospital, while it is all should all be natural. So strapping a pregnant woman down to the bed because she has to lay still because of the monitor, because they have to listen to the heart rate of the child, etc. But if you look in nature, the mammals, they pace, they walk around, they move. They don't lie flat on their back, which is actually anti-gravity, right? It's harder work to get the baby out. So I watched some YouTube videos about women in labor the natural way. No epidural, no aggressive pushing. Both mom and baby were getting ready for this life experience. No trauma for the baby, and it looked peaceful in spite of the mother's pain, of course. There was no cutting of the umbilical cord right away, and no washing of the baby either with, chemical soap, and no using of disposable diapers. And the cutting of the umbilical cord, that's another thing, because there's still going blood from the placenta pulsating through the umbilical cord through to the baby. And the baby has less blood in its body, and is actually, you have to wait until the last blood from the placenta has been delivered to the baby, and then you can cut it. So cutting it too early will actually cause the baby to not have enough blood, and that can actually be dangerous. So you have to wait for at least 20 minutes. You have to wait until the umbilical cord stops pulsating, and then you can cut it. The myths around pregnancy is that pregnant women should rest on the bed. But no, bed rest actually increases the risk of pulmonary embolism. And also, they do a glucose tolerance test for pregnant women, but I guess it's normal that it's a little bit higher. So, because the pregnancy hormones, they block the effects of insulin. So the thing you have to do is you have to adjust the diet to a low carb, high fat, high protein diet. And there should never be any ultrasounds done for just the fun of it. Because ultrasound is sending frequencies of sound waves that bounce off the fetus's organs, fluids, tissues, creating an image that is projected on a screen. And ultrasound is no better than what the midwife can do with her hands. Gender identification with ultrasound is also not very reliable before 15 weeks. And so ultrasound altogether, actually, you should never do this. And then another myth is the amniotic fluid tests, because they are very unreliable as well, and they lead to unnecessary inductions or C-sections. And C-sections, actually, they used to be done in, because they call it cesarean, because in the Roman Empire, they used to get the baby out that way when the mom was dead. So to save the baby's life. That is where the name C-section comes from. And then the prenatal vitamins, actually those cause more harm than good, because they're full of synthetic chemicals, fillers, and colorants, and the mother doesn't need it. Just have a good diet. Obstetricians are financially incentivized to see as many prenatal appointments in a day as possible. You don't need that many appointments. Being pregnant is not like something, you have to follow every day, every week. No, just let the natural process go its course, and you don't have all these. But for the obstetrician, of course, they get more money with more appointments, so that's why they do it. So the midwives versus obstetricians is proactive versus reactive care. So midwives, they earn like $100,000 a year, and obstetricians $450,000 a year. So it's a big difference. And if you have your delivery done by a midwife, it costs you about $1,500, and an obstetrician, it can cost $4,000. Actually, but I will talk about hospital costs, because that is crazy, man, crazy. Yeah, testing. Actually, testing causes stress to the mom and has negative effects on the baby. So yeah, you don't need that many ultrasounds. It can cause autism, and that's why the Amish per people have the lowest rate of autism among their children, because of that reason. They don't do that many testing, and their children are healthier. Ultrasounds today are 8 times more intense than used before in 1991. And yeah, we should never do ultrasounds just for the fun of it. The cost of an ultrasound is between $200 and $700, and the cost of a midwife checking can be max $100. And the US has the highest rate of childbirth-related complications and medical malpractice in hospital deliveries. So that's what I said. The hospital is a business. Hospitals save money when they are minimally staffed. 90 minutes in a birthing room is $2,000. It costs $26 a minute. And the epidural is $530. And the average hospital delivery costs $36,000. So before the baby is born, they take all your money. And the insurance only reimburses 1 day in hospital. And so, yeah, can you imagine if you are 3 days in hospital, then, you have to pay you can have like a $60,000 bill after you deliver the baby. So they put you, when you get into the hospital, you get this hospital gown on, they put you in a wheelchair, and then they medicate you, they strap you to a bed to fetal monitoring. They don't give you any food or drink because that can interfere with the medication. And yeah, so there was another movie about this. It's called The Business of Being Born. And yeah, C-section is $51,000 in the US. A vaginal birth is $36,000, and home birth can cost like about $5,000. And the costs in Iceland actually is zero. So there it's free. Most women actually don't realize that a cesarean is a major operation, and it involves risks to both the baby and the mother. And a woman is 4 times more likely to die by C-section compared to vaginal birth. And babies delivered via C-section have a greater risk of having breathing problems, difficulty breastfeeding, and allergies and stuff later in life. And yes, so, it's just crazy, man. Standard of care, right? It's harmful. The C-section rates in the US is 35%, and in Iceland only 14%. Note, because obstetricians, they lack the patience to wait for nature to go its course. So that's why they like planning C-section, because it gives them more money and they can actually plan it. In an hour you can get the baby out, while a normal birth can, last between 15 and 30 hours. But statistics show, of course, that midwife attended births have better outcomes. So yeah, there are other things that when you give birth in hospital, they take away the baby right away. They're gonna wash it, and they're gonna check it and stuff. They're gonna cut the umbilical cord, and the washing of the baby. Actually, baby comes with that normal vernix on it. It's actually a probiotic protection for the baby and good for the immune system. The smell of it also soothes the baby, and the baby can rest on the mother with the vernix still on, because it's also a good protection. Yeah, this Johnson and Johnson baby wash is actually very harmful. There have been, lawsuits about it as well. And they inject the baby with a vitamin K because it's against clotting. It's only because when you cut the umbilical cord too soon, then there's more bleeding, and then the baby loses more blood and then needs to clot. And that's why they give vitamin K injection that the baby doesn't need if you cut the umbilical cord later. And by the way, the colostrum, the first milk, is all the baby needs. And yes, another one, circumcision. It's very, very harmful to the baby. Yeah, and nobody knows their rights in hospital as well. Just before I go to the circumcision, the average NICU, so that's when the baby is born too early, they go into this area for babies. It can cost like $45,000, and it's not grounded in evidence-based practice, because a normal baby needs nothing more than skin-to-skin contact with the mother, a quiet environment. They're instead washed, injected, subjected to chemicals and bright lights. Yeah. So now the circumcision. Oh my God, it's cutting away erogenous tissue. I already talked in another video about circumcision. It is the there was the book about function of the orgasm. Anyways, you can maybe watch that video. The procedure is actually banned here in the Netherlands because it endangers an infant's health and because it is ethically questionable. It is mutilation of the penis. Yes, with great complications, and botched circumcisions are more common than you might think. Some are even that they cut off by accident portion of the head. Oh my. And then the foreskins, they're actually sold as high-end beauty products. Just as they do with the placenta and the umbilical cords, they make beauty products out of it. So the cost of a circumcision is $1,400 and a very angry baby and a bloody mess. And they resell this foreskin thing, I don't know, it's thousands of dollars as well. And yeah, it's just crazy. Then it's about breastfeeding. It actually, in the milk are actually the white blood cells that stimulate the immune system. So that's why babies that have been breastfed, they suffer less allergies and they have more robust immune systems. A better metabolic health, better lung health, so no asthma. They develop more brain cells. Also the ADHD thing is more common in babies that have never been breastfed. Breastfeeding helps the mom lose pregnancy weight and also reduces the risk of suffering from diabetes. And actually, they promote this infant formula in hospitals, right? And did you know that these infant formula producers also make diabetes management products? Yes, because what that is, actually, it's just water with sugar. Do you know what they gave my dad, who had this chemotherapy, and you know that cancer is a metabolic disease and sugar feeds the cancer? But because they didn't want my dad to lose any weight, they sent him home with a lot of these Ensure drinks, that is sugar and water. This is the worst thing you can give to a cancer patient. You know, on one side, you're going to give him chemo, and the other side, you're going to feed the cancer. It's just, crazy. And And they hand out free samples of this Similac and Enfamil, poison stuff. False advertising. But yeah, in the hospital, they feel to, they have an ethical obligation to inform the new parents about everything. But yeah, they get a lot of, they're bribed in hospital to prescribe all these fake things. Yeah, I don't know. It's just, they get free stuff and yeah. So they apply with people with enough food, friendship, praise, free education, and free stuff, and they start to believe whatever you tell them. And then about the diapers, we got these plastic disposable diapers. So actually, there's some chemicals in there that can actually very irritate the skin. Most women in Africa, they just carry the baby, on their backs, right? And their babies, they actually in a few weeks after birth, they're potty trained. And so I think here, in the Western countries, that's where it takes sometimes 2 years. And an average number of diapers needed per year, the cost, 3,000. And if you do cloth diapers, and you need like maybe 30 of those washable diapers, and it costs you $500. And last but not least is vaccinations. Of course, I don't have to tell you that they're harmful always, and they never save but always shorten lives. Injecting over 50 times a baby before its first baby steps is just crazy. It's a for-profit business. It mentions many vaccines, but the hepatitis B is particularly worrisome, as it can cause cell death and mitochondrial diseases. By the way, it's a so-called, hepatitis B against is sexually transmitted disease. Why should you give that to a baby? You have to wonder why. Well, all vaccinations have side effects, some very serious, like autism and death even. And pediatricians, they will insist on taking them, and every visit will feel like a battle if you do not want to have your baby injected. But in all the vaccines, there's this aluminium as adjuvant, and it's very toxic for especially a small baby. So the unvaccinated children are the most healthy with the most robust immune systems. Higher infant vaccine rates correlate with higher infant mortality. And the cost of getting no vaccine at all? $0. Yes, it's free. And then in the book, there was like a recommendation to read the book, How to Raise a Child in Spite of Your Doctor. So I've got that one as well. It's this one. So I will read that one next, and maybe there's some new information about this, but I guess this was pretty complete. So wish you a nice day. Bye.